Canadian health officials and officials around the world are keeping a very close watch on a new virus in China. It's known as novel coronavirus. So far, 300 cases have been reported and 6 people have died. And before this week, the virus remained in Asia, but now it's hitting closer to home with 1 confirmed case in Washington state. Como News posted aerial video of a hospital in Everett, Washington, where a man in his 30s is in stable condition, according to U.S. officials, just a 2-hour drive away from Vancouver. The U.S. resident arrived home last week after visiting Wuhan. Officials say he had no symptoms when he landed, but contacted doctors the next day when he started feeling ill. This is before U.S. federal health officials began screening travelers from the outbreak's epicenter at 3 U.S. international airports. This is the 5th country to report seeing the illness, following China, Thailand, Japan, and South Korea. Here in Toronto, the medical officer of health saying the city has unique experience dealing with new infectious diseases.
We are monitoring, actively engaging in communications, and are preparing ourselves so that we're ready. That's one of our fundamental roles in public health.
We spoke with infectious disease specialist Dr. Alison McGeer, who explains what exactly a coronavirus is.
It is causing respiratory tract infections, so that's colds, influenza-like illness, pneumonia in people.
Do we have the tools to fight something like this if it were to come here?
In a worst-case scenario in which this is developing into the next pandemic, extraordinarily unlikely but not impossible, yes, in the end we will get through it. Are we optimally prepared to deal with that worst-case scenario? Almost certainly not. Are we prepared to deal with another SARS? Yes, absolutely.
The Public Health Agency of Canada will be taking extra measures in the coming days at the Vancouver, Toronto, and Montreal airports to stop its spread. There will be signage to remind flyers to inform border service officers if they experience flu-like symptoms. There will also be an additional question related to the coronavirus on electronic kiosks. So far, 3 people have been investigated in Canada but have been ruled out. They were travelers to Wuhan.
Based on current information, an animal source seems the most likely primary source of this outbreak, with limited human-to-human transmission occurring between close contacts.
Earlier today, Wuhan Mayor Zhou Xianwang warned if it isn't necessary, avoid visiting Wuhan, and for residents living in the city to not leave. The World Health Organization will be holding an emergency meeting tomorrow with a panel of experts to assess whether this outbreak should be referred to as an international emergency.